Hello. Welcome back from a break. I hope everyone had the chance to stand up, stretch, get some refreshments, and I hope you're all caffeinated and fired up for our next session. We're going to dive right back into the last sessions of the morning. We talked earlier this morning about policy changes on the federal level, and we're now going to continue our conversation with action on the state level. Because across the country, states have proven a powerful engine of change to advance women's rights and gender equity. We've seen ambitious policy advances on issues from abortion access to pay equity to child care, and state houses currently offer the most immediate and tangible opportunities to pursue policies that will transform the lives of women and families, as well as, in many cases, the last line of defense against regressive policies. That's why at IWPR, we are currently building a new online resource, the State Policy Action Lab, or State PAL, which will bring together the policy and research from IWPR's longstanding Status of Women in the States project to support data-driven state legislation that advances gender equity and women's economic empowerment. Through this project, we're very excited to provide the high-quality, reliable state-level data in a way that is easy for policymakers, advocates, and others to use in pursuit of transformative change. I am so excited to introduce our next three speakers, Fatima Goss-Graves, Aijin Pu, and Kelly Baden. Each of these visionary leaders is focused on critical policy issues in play for women at the state level: pay equity, reproductive rights, and care. We're so excited to have them joining us today to talk about the importance of making progress on these key issues at a state level. Let's take a look.
Good morning. All right, you guys are hyped up. I'm Fatima Goss-Graves. I am president and CEO at the National Women's Law Center. I'm a lawyer, and I'm actually the first lawyer in my family. I grew up hearing and understanding a lot about the law through the stories of my family. This is not why they married, but both of my parents and their families were plaintiffs in school desegregation cases in Tennessee and in Michigan. That is not why they married, but it does turn out that I grew up understanding civil rights and the power of legal reform through those stories. And I wanted to be a lawyer because I wanted to be a part of the folks that drove those sorts of changes. So early in my career, I found myself at the National Women's Law Center. And at the Law Center, we fight for gender justice, and we use all the strategies we can think of in the courts, advancing public policy at the federal level and states through culture making, research. And one of the first campaigns I got to work on was the Lilly Ledbetter Fair Pay Act. With some of you all in this room. I think Jocelyn Fry is probably here. I see Kristen in the back. And just to take us back to Lilly Ledbetter, for those of you who don't remember, the Supreme Court had come out with a decision that basically made our pay discrimination laws impossible to enforce. And so along with so many partners in this room, including IWPR, we galvanized and worked alongside Lilly Ledbetter. And in less than 2 years, Congress had passed a law to restore it. They heeded the call from Justice Ruth Bader Ginsburg, who said, "Congress, the ball is in your court," and they changed the law. It doesn't always happen that fast at the federal level. Yet we, since that moment, around the question and issue of equal pay, have been undaunted. You see, the Lilly Ledbetter Fair Pay Act campaign, it reminded people around pay disparities in this country and what they do for our lives and what it means for women at work to be so deeply undervalued. It also reminded us that we could possibly change our laws to make a difference. And it reminded us that things like occupational segregation, the fact that women were concentrated in the lowest paid fields but nearly shut out of the highest paid fields, had to be addressed. Things like the motherhood penalty and the price that women in particular pay for caregiving was a part of that wage gap that needed to be fixed. And it really reminded us that the fact that the pay gap for women of color was as large as it is, that for Black, Latina, and Indigenous women in particular, that for some groups of AAPI women, that we needed to make that gap visible and actually begin to solve it. So we have been undaunted and working at all levels since. And I wanted to tell that story of winning around the Lilly Ledbetter Fair Pay Act because I'm about to give you some bad news. The bad news is that just this month, we learned that for the first time in 20 years, the wage gap has widened. And for Black women in particular, they were paid in 2023 just 66 cents for every dollar paid to white non-Hispanic men. That's down from 69 cents in 2022. So you may be thinking in your head, how much is 3 cents? I'm going to just tell you 3 cents is a lot. That level of backward change is a lot. And what it means to make 66 cents on a dollar, and I always go back and forth about whether we should talk about it in cents. Does that make people think that this is a small thing? That's over $25,000 a year in wages loss. So when we think about our need to drive urgent and serious progress, we got to do everything we can. And the power of moving equal pay in the states has been proven again and again. We've had states like California and Vermont and New York and Nevada and Oregon and Maryland and Colorado and Illinois work with serious intention and actually shrink their wage gap over time. I just want to be clear, those states also not done because they still have very, very large wage gaps for Black and Latina women in particular. So if you're from one of those states, you don't get to party yet, sorry. And still, we can't spend our time only in states where we have decided we can actually move bigger and bolder ideas. We have to work in places that feel hard and maybe even impossible. Mississippi, Alabama, and Louisiana have some of the largest wage gaps in this country. They also have some of the highest poverty rates for women and families. Those things are connected. And they have the fewest anti-discrimination and labor protections from anywhere in the country. They are relying on the already low federal baseline for protections. So it might be easier to think, let's focus elsewhere. Maybe let's focus in places that have not been so gerrymandered, or where we could actually drive progress as fast and possible. I have to tell you, no, actually our task is to double down. And we cannot also disconnect that these numbers show us moving backwards in the very same year that we had the first year that our country went without a federal right to abortion. The widening of the pay gap, it's a policy choice. It doesn't just rain from the sky with nothing we can do about it. We can make different decisions. And so I just want to end with a case study on pay transparency laws, because it's given me some hope and progress that action can happen and we can move forward in ways that make a difference. In order to really get at pay disparities, we all knew that strong enforcement of our existing laws was not going to be enough. We had to ensure that employers had incentives to pay their workers right the first time. And one of the best tools to ensure that that happened is by making pay more transparent. You know, that old saying that sunlight is the best disinfectant. That is especially true when it comes to fair pay. So employers that look at their data, or that they know that other people are going to look at their data, they're more likely to pay people fairly. Less than 10 years ago, we were having a very different conversation around pay transparency. Workers and policy advocates were campaigning to employers and to lawmakers and say, please, can you just make it so you don't fire people who want to talk about their pay with each other? That felt small, yeah? So now, job applicants and workers, policy advocates are saying to employers, it's up to you to prove to us that you are paying us fairly. You're the ones with all the data. That's your job. So Colorado went first. Is anyone from Colorado? Colorado went first. They passed the first law requiring employers to include pay ranges in job announcements. California and Illinois followed just a couple years later, requiring in their states that companies actually give pay data by race and by gender and by ethnicity to government agencies. So somebody other than the employer was checking to make sure they were paying right the first time. Since 2019, 13 states in the District of Columbia have passed pay range transparency laws. 4 passed just this year alone. And 17 states in the District of Columbia have moved to pass laws that basically say you can't do salary matching. You can't make it so that the pay that you have in your current job is only the pay you had in the last job. It was keeping women in a circle of always being the ones to be paid less. So we can feel like these moments are maybe accidental and like momentum just happens. That's not what happened, y'all. This is a result of deep and serious organizing around the country. After Colorado's law passed, California came next thanks to the fortitude of groups like Equal Rights Advocates. Are they here? Thank you. A few months later, New York passed, thanks to groups like Legal Momentum and Empower Her. Each of these campaigns were forged with deep work from labor, civil rights, women's rights groups coming together demanding change. Illinois went thanks to groups like Women Employed here in the Shriver Center. And Maryland came. By the time we got to Maryland, the business community was like, oh, wow, we now have to follow laws that look different in a lot of states. That campaign was very different. We had organizations that were doing their own studies. SHRM did its own studies saying that actually people want pay transparency. If you want to recruit workers, you got to do that. And then the influencers came, telling their equal pay stories in entertainment and in sports. When the U.S. women's national team won, it was not an accident that the crowd chanted equal pay. So here's the thing that I want to leave you all with. It may feel daunting to be in a situation where we see retrenchment. It is hard to face that reality. But never in the history of our movements in this country do we wake up and say it's time to give up. We fight on every terrain, and that terrain must include in the states and in local governments that are driving change even when it's hard. We don't write off our sisters who are working deeply, especially in the South, up against unbelievable odds that were not built overnight. We fight to change the culture that says it is okay to devalue women's labor and to pay them unfairly because of what they do. And we invest, and if there are donors in the room, you won't be surprised that I'm the one to say this. We invest in ways that are flexible and unrestricted and that assume that the people are going to win. That is all of our tasks here. And I believe that we will do it in the end, and we could come together to make it so that this wage gap is a thing no more. Thank you.
Good morning, everyone. Thank you to the Institute for Women's Policy Research for gathering us here in Chicago, the city in which I live. Welcome to all of you who are not from here. This is an incredible room. It's all stars here. And shout out to the Illinois Domestic Workers Coalition, and shout out to Illinois Care Can't Wait. We've got our leaders here, Women Employed, SEIU. All right, so I am an organizer, not a closet organizer, a people organizer. And it took me a few years to explain to my parents what that was. I've spent most of my life organizing with domestic workers and caregivers. How many of you know somebody who works as a nanny, a house cleaner, or a home care worker, or maybe did that work yourself? Okay, so this is a room that knows exactly what I'm talking about when I say that domestic work is some of the most important work that exists in our economy today. Nannies who nurture the human potential of children, home attendants and home care workers who uphold the dignity and quality of life of our aging loved ones, our disabled loved ones. It's the work that makes all other work possible. And yet it's some of the most insecure and undervalued work in our entire workforce, as you all know too well. And it is not an accident that it is that way. More than 90% women, majority women of color. Domestic workers have been excluded from our nation's labor laws since they were established in the 1930s as part of the legacy of slavery in the United States. And as a result, this work has been poverty wage work with average pay of less than $12 per hour, no health insurance, no job security, no paid time off, no safety net. It's basically like the Wild West, where you might happen to find a great family that you're working for, and then there's the whole other end of the spectrum of human trafficking, rape and sexual assault, and everything in between. No standards, no guidelines, and very little power to negotiate. So as a young organizer, I went to the parks and the playgrounds in Manhattan. I used to live in New York before I moved to Chicago. I would go to the parks and playgrounds and listen to the stories of the nannies who were on the park bench taking care of the kids. And I realized that women wanted to break out of the isolation of domestic work and come together to organize. And so in 1998, we formed a committee of Filipina domestic workers, the Women Workers Project, as part of the Committee Against Anti-Asian Violence. And then in 2000, we launched Domestic Workers United, the first multiracial domestic workers organization. And we decided together to launch a statewide campaign to set standards and raise the level of respect for domestic work, a campaign that would be called the Campaign to Win a Domestic Workers' Bill of Rights in New York. But we wanted to make sure that workers were engaged and informing and driving both the substance of what would be in the Bill of Rights and the process at every level. So in 2003, we organized a convention to try to bring as many domestic workers into one conversation about rights and respect at one time. So we had about 200 workers and simultaneous interpretation in 7 different languages, and we sat around tables just like this one, and we had a day of conversation about what it would mean to be respected in this work of care. And we came up with 47 different provisions, which we then prioritized and honed and turned into a framework for a bill that we then took to Albany as soon as the legislative session started in January of 2004, found a sponsor, and thus began the campaign to win a Bill of Rights for domestic workers in New York. And 6 years later, New York became the first state in the country to pass a domestic workers' Bill of Rights. In the middle of the campaign, we began connecting with domestic workers around the country. And they would come when we would have a march or a lobby day, and they wanted to lead and drive campaigns like this around the country. And about 50 of us decided we were going to have a meeting to learn from each other in our organizing locally around the country. So we had 50 organizers and domestic workers from 12 organizations in 6 different cities around the country in 2007, and we realized the incredible power of coming together across this country. And we committed to helping one another build locally and win statewide. We believed that coming together nationally could help us build the power that we were trying to build at the local and state level, and the other way around, and we weren't wrong. We launched NDWA, and today we are 400,000 women strong, and we have passed bills of rights in 13 states and the District of Columbia. But it didn't take long for us to realize that the devaluing of domestic work and the exclusion of domestic workers is a manifestation of a much bigger problem we have in this country, which is that we do not value care. As a country, we have not invested in building the kind of caregiving systems, policies, or workforce that would support us to take care of the people we love. From childcare to paid family and medical leave to aging and disability care, we have not invested in those programs. What we have instead are 53 million overstretched family caregivers and working parents, 9 million shockingly underpaid care workers working in the care economy, including domestic workers, or in the words of social scientist Jessica Kolarko, other countries have a safety net and the US has women. The thing that was becoming more clear also was that this pressure that we were all feeling at the lack of support for care was becoming a crisis, is becoming a crisis. As the baby boom generation ages and more people live longer, we are a nation that needs more care than ever before. And that is why in 2011, Sarita Gupta and I co-founded Caring Across Generations to bring, thank you, Fatima, to bring workers and family caregivers and all of our families together to change the way that we value and support caregiving in our country. And both of us, having started in local and state-based organizing, we knew that states would have to be the laboratory and the incubator for federal level change. And so we were really excited when organizers in Hawaii made sure that Hawaii became the first state in the country to pass a family caregiver benefit called the Kapuna Caregiver Program, which offers people in Hawaii who are caring for their loved ones at home a benefit of up to $74 per day to pay for the expenses related to caring for someone at home. And 13 states and the District of Columbia around the country have passed paid family and medical leave bills. Hawaii could actually be next. We're working on that. Washington State passed the first long-term care benefit in the country called Law Cares. Huge. And New Mexico passed a ballot initiative to permanently fund childcare in the budget. Amazing work. Hi, Julie Cashin, who worked on that. Each of these state precedents, like the domestic workers' bills of rights, took years of organizing, base building, coalition work, and action. And what it has done has set the stage for this moment of transformation that we are all in. Thanks to all of this work and a pandemic that awakened a lot of people to just how essential care work is, we have found ourselves in a once in several generations moment of opportunity to transform the way that we support caregiving in our country, to build the care systems we need to help us take care of the people we love. Both NDWA and Caring Across Generations, together with dozens of organizations around the country, Moms Rising, shout out Kristen, Community Change, National Women's Law Center, National Partnership for Women and Families. I know Jocelyn is here somewhere. The ARC, Family Values at Work, SEIU, AFT, so many amazing organizations are a part of the Care Can't Wait movement, and we are working together to pass policies that will lower the cost of caring for our families, paid family medical leave, affordable quality childcare, making care for seniors and people with disabilities affordable and accessible, especially in the home and community. And our coalition has been winning steadily since the pandemic, building power that we never thought imaginable. We have made history alongside the Biden-Harris administration, putting care at the center of the economic agenda for our country, passing a historic bill through the U.S. House of Representatives that was literally included historic investments in all of our care policies. It didn't make it through the Senate yet. But the president and the vice president followed up with their promise to us by passing a historic executive order that included more than 50 different directives to every federal agency to do everything in their power to make care more accessible and affordable, and this work is ongoing. This generational opening was made possible by the local and state work that offered the building blocks, the models, expanded what we understood to be possible, and helped our communities build power. This opening doesn't happen without that foundation. Just like care work is the work that makes all other work possible, local and state-based organizing and power building is the work that makes national level change possible and durable. Now is the time to double down on both. This is our moment. We are the generation that is going to fundamentally change the way this country supports our ability to take care of one another and the people we love. This is our moment. Thank you.
Good morning, good afternoon. I'm so honored to share the stage with these incredible speakers, share a room with all of you, some of the leading experts, thinkers, and doers when it comes to women's power and women's voices in policy. My name is Kelly Baden. I'm the Vice President for Public Policy at the Guttmacher Institute. We are a global organization that uses science and research to make policy change to advance sexual and reproductive health and rights here in the US and around the world. I have the honor and privilege of spending every day with my team tracking and analyzing the thousands of state policies on reproductive health and rights that are considered each year, and working with our scientists to understand the impact that those policies have on people who need abortion care. And I was tasked with talking about wins. And I will be frank, it's a little bit of a struggle sometimes to think about the wins. How do we celebrate when we have lost so much? 14 states have total abortion bans. Other states have 6-week abortion bans, 12-week bans, 15, 20, 24, the list goes on. And they're not stopping there. On top of the numerous new laws that have been enacted over the past decades that make abortion more expensive, harder to get, more stigmatizing, the new post-Dobbs landscape gives us an alarming insight into where we might expect to see the anti-abortion movement go next. Millions of women now of reproductive age live in a state that doesn't just ban abortion, but perhaps is surrounded by other states that ban abortion as well. And so as a result, Guttmacher data shows that interstate travel for abortion care has doubled, with nearly 1 in 5 patients now forced to leave their states to get abortion care in a state where it remains legal. In response, states and localities are testing the limits of what it is still possible for them to do after they've already banned abortion. This year, 4 states introduced legislation, and 1 passed a law criminalizing adults who help young people leave their state to access legal care somewhere else. That is echoed by the efforts of cities and counties in Texas trying to restrict use of their roads and highways to leave the state to get an abortion care where it is legal. Alabama's Attorney General is trying to prosecute anyone who helps support a patient leaving their state to get care where it is legal. And of course, earlier this year, the Alabama Supreme Court issued a decision that classified frozen embryos as children, which gives us a scary hint as to how they are going to try to enact fetal personhood into law and policy. So the list really, unfortunately, does go on, and these incredibly alarming state efforts are buttressed by a national strategy to restrict access to medication abortion no matter what state you live in, and to even threaten your ability to get abortion care in the case of an emergency if your life or health is at risk. And your life and health may be at risk. How do we talk about wins when women have died? This devastating news that came to light last week, Amber Thurman, Candy Miller, it's heartbreaking. And their stories are not just about abortion bans, because abortion bans are never just about abortion, it's about so much more. So these are stories of medical and structural racism, chronic illness, a fear of criminalization, a hostile climate. All of these things are what are created by or exacerbated by abortion bans. So what is our way forward when things feel so bleak and so hard? I would never ask anybody to find a silver lining in this moment. That's not possible. But as noted abolitionist, educator, activist Miriam Kaba says, hope is a discipline. So my call to action as a woman, as an abortion rights advocate, as a white woman, is to hold all of these realities, these tragic outcomes and their disproportionate impact, especially on Black women, at the center of my work. And to embrace the complexity and the nuance of what the landscape does look like in a post-Dobbs world. Because while abortion bans are harming us is not surprising, there are other factors that are a little bit surprising, perhaps, about what abortion provision looks like now in a world where we have 14 states enacting total abortion bans. So for example, Guttmacher data show that more people accessed abortion care in 2023 than in 2020, and while the number of brick and mortar clinics has declined, the abortion rate has risen. As I said, the proportion of patients traveling out of state for care has doubled in recent years, reaching nearly 1 in 5. And as you can imagine, the sharpest increases are in states that border abortion ban states: Kansas, Colorado, New Mexico, and of course here in Illinois. In fact, no state has been able to receive and see as many out-of-state abortion patients from as many states as Illinois does. And that's not an accident. That is because of real policy wins here in Illinois and in some of these other states that I mentioned that have helped make a tangible difference in people's lives. And the commonality of some of these states is that they didn't shy away from the moment. These state leaders, legislators, activists, advocates, many of you saw that people are looking for champions. They're looking for leaders to understand the centrality that abortion plays in our lives and act and legislate accordingly. So I am hopeful when I see some of these state policies, not just protecting legality, but expanding access. And we know that for patients, leaving their state to get care in another state comes at great cost, financially, logistically, perhaps emotionally. And there is an amazing network of abortion funds, practical support organizations, clinic staff, a whole network of people who work tirelessly every day to help match patients to a clinic that can see them. And this network is not a substitute for sound public policy. In the long term, it can't be. And so the agenda of abortion opponents is long. It does not end here. 14 states banning abortion is not their end goal. And so our response and reaction has to meet the moment. On top of a national agenda, not just to reinstate Roe, because that is not enough, but to actually reimagine what abortion rights can look like, we also need states to continue mitigating the harms caused by Dobbs in this moment, to see the bigger picture and find the smaller wins. So that looks like expanding and strengthening shield laws. States like Massachusetts and New York and California have done to make sure that abortion providers in those states are not prosecuted or criminalized by states with abortion bans. Yes. It has to look like seeing how attacks on gender-affirming care are the same fight as attacks on abortion rights and need to be worked on together in unison to protect people who need care. It looks like protecting consumers' healthcare privacy when they're seeking reproductive healthcare service, which Maryland has done, protecting the right to contraception, sex education, certainly to protecting and improving maternal health, especially for Black women. It looks like removing any and all bans on public or private insurance coverage for abortion, bans on later abortion. It looks like cities and states funding abortion directly. And tactically, we do know how to do this. Lessons from state wins are clear. You speak authentically, you find your values, and that is what you extend to other people to find common ground with. You use those shared values to advance policy change. You don't shy away from the hard conversations. Research and science is necessary but not sufficient for policy change. The voices of providers and patients have to be paramount. We used to say, right, conventional wisdom, all politics is local. Now, all abortion politics is regional or even national. Every state's abortion policy has an impact well beyond the borders of that state. And so our work to win in states has to be regionally and nationally informed. A person who needs to leave Louisiana to get to care in Illinois is carrying the weight of national and state laws and regulations on her back as she makes her way here. Of course, all of those good tactics cannot necessarily overcome the structural limitations that many of our governing bodies, our legislatures, have baked into their very existence. And so abortion justice is also democracy reform. We cannot operate in silos. We have to do this work together. At Guttmacher, one way we're doing that is convening state experts together to be grounded in the evidence and also have the context of the state experience to co-generate, co-create new policy concepts together. We call this a policy innovation hub. And we're working with many of you to continue doing that. So I invite you to join me in channeling our heartbreak and our rage in this critical work and creating a vision for true sexual and reproductive health and rights here in the US and around the world. We don't only have to learn from each other in states, but also from our sisters in Latin America in the Green Wave, who have made huge strides in Argentina, Mexico, Colombia, and more, to folks in Ireland, France, and around the world who have been securing, protecting, and liberalizing their abortion laws as well. So hope is a discipline. We practice it when it's hard. Thank you very much. Happy to do this all with you.